Ohio's Medical Marijuana Control Program, an overview for physicians. House Bill 523, effective on September 8, 2016, is the law that legalizes medical marijuana in Ohio. The Ohio Medical Marijuana Control Program allows Ohio residents with certain medical conditions to purchase and use medical marijuana if they have a recommendation of an Ohio licensed physician certified by the State Medical Board of Ohio. House Bill 523 tasked 3 state agencies with setting up the framework and details of the program by September 8, 2018. The Department of Commerce is responsible for cultivators and processors. The State of Ohio Board of Pharmacy is responsible for patients and caregivers, authorized forms of medical marijuana, and dispensaries. The State Medical Board of Ohio is responsible for physicians and adding qualifying conditions. In this brief program overview, we will review the process physicians should follow when recommending medical marijuana. However, this information may also be helpful for all healthcare providers, as they will probably encounter patients who are part of Ohio's Medical Marijuana Control Program. All physicians, especially those wishing to recommend, should be familiar with the Medical Board's rules for the program, especially the Standard of Care Rule found in Ohio Administrative Code, Section 4731-3203. Ctr Application. Any Ohio physician with a full unrestricted MD or DO license can apply for a certificate to recommend medical marijuana, also known as a CTR. Start by completing a 2-hour CME course on medical marijuana that has been approved by the Ohio State Medical Association or the Ohio Osteopathic Association. Log into elicense.ohio.gov and apply for the CTR. The State Medical Board of Ohio will approve qualified applications for the CTR each month at the board meetings. You will know your certificate to recommend is approved and active when the letters CTR appear at the end of your license number on elicense.ohio.gov. Once a physician's certificate to recommend is active, the physician will see the patient and certify that they have a qualifying condition. These conditions were outlined in House Bill 523. The physician will need to see the patient at least once per year. A physician can recommend up to a 90-day supply of medical marijuana with 3 refills. But the physician may want to see the patient more often, depending on the condition. Following the exam that confirms a patient has a qualifying condition, the physician or physician's office staff will then set up the patient in the official patient registry. There are no separate forms to complete. To be part of the program, a patient must be entered in the online portal. The Ohio Medical Marijuana Control Program Patient Registry is fully developed. However, the Board of Pharmacy has not yet made this portal live. The go-live date for this registry will happen in conjunction with product availability in Ohio dispensaries. Physicians with active CTRs will be notified when they are able to start using the patient registry website. Next, the patient logs into the registry to confirm information and pay the $50 fee. The online registry will generate a patient card they may print and carry with them if they wish. Then the patient goes to the State of Ohio dispensary, provides the government-issued ID associated with their patient account, such as a driver's license or passport, and works with the dispensary staff to select product. Dispensary staff will double-check the patient in the registry. This will allow staff to learn about the patient's qualifying condition and see the physician's notes. This can all help them select the most appropriate product and dosing at the dispensary. The patient will purchase the product, then the dispensary staff enters the patient's marijuana product information into ORS. Any ORS user can check to confirm that a patient is officially part of the Medical Marijuana Control Program. The ORS account holder can log in and look and see if a patient has lawfully purchased the product at an Ohio dispensary. All resources for the program can be found at medicalmarijuana.ohio.gov, including the law established by House Bill 523, the Ohio Administrative Code rules for the program, details on CTR eligibility for physicians, an overview of the Medical Board's expectations for physicians, a quick link to a list of physicians with a CTR, and links to dispensary locations throughout Ohio. medicalmarijuana.ohio.gov also features an email sign-up so you can receive program updates, as well as a quick link to the toll-free helpline for patients, caregivers, and health professionals. Anyone can utilize the toll-free helpline by calling 1-8334-OHMMCP.